Hello and welcome to Askimo TV. I'm talking today to Dr. Nisith Sheth. Dr. Sheth is a consultant dermatologist and dermatological surgeon at St. John's Institute of Dermatology in London. Hi, Dr. Sheth. How are you?
Very well, thank you.
Dr. Sheth, let's talk today about skin cancer and what people should know about it. So what types of skin cancer are there?
There are many different types of skin cancer, but essentially there are three main types. There is melanoma and non-melanoma type skin cancer, which are mainly basal cell and squamous cell carcinomas.
How common is skin cancer?
Skin cancer is probably one of the most commonest cancers in the Western world. In the UK, there are about 12,000 new melanoma cases every year and about 100,000 basal cell carcinomas every year.
What are the risk factors that people should be aware of for skin cancer?
The most common risk factor is ultraviolet radiation, mainly in the form of sunlight, but also from sunbed use, for example. Genetic factors play a part, and so people with very fair skin who burn easily can also get skin cancers, and also some other conditions can predispose to it as well.
Can you just mention the three types of cancer that you've just spoken about and what the signs and symptoms of each would be?
So for melanoma, by and large, these are what we call pigmented lesions, so they're usually brown in colour. They can be on any body site, but mostly the sun-exposed parts. And often it's a mole that is irregular, dark in colour, with an irregular border and shape, but sometimes they can have no colour within them. The other types, non-melanoma skin cancers, are often flesh-coloured or pink-coloured, sometimes scaly, sometimes they can be a flat, scaly area, sometimes they can be a lump or a sore.
What causes skin cancer?
It's probably a combination of things. So there's an underlying genetic predisposition in some people, but it's often triggered by ultraviolet radiation causing mutations within the skin cells of the skin.
What sort of treatments are available?
There are many different treatments available now for skin cancer. Surgery is the mainstay, and so that involves either cutting it out or scraping off the skin cancer and burning them. But now there are lots of other different types of therapy, including photodynamic therapy, cream or topical treatments, and for more advanced skin cancers, there are now some new systemic therapies coming out as well.
And how effective are these skin cancer treatments? And what's the prognosis for recovery?
So if skin cancers are caught early enough, the prognosis is very good, with potentially 100% cure in many cases.
Thank you, Dr. Sheth. Thank you so much for talking to me today.
Thank you.